Caught in Charlotte's web, the battle for the legalization of medicinal cannabis. This is Charlotte's story and how cannabis saved her life. This is Charlotte, who looks carefree and without complications. However, what you're about to see is how epilepsy affected her life.
This is what Charlotte and her mum, Paige Figi, were dealing with every 30 minutes.
Charlotte Figi is one of the many sufferers of epilepsy, a form of the condition known as Dravet syndrome. She used to suffer 300 seizures a week until her family discovered a strain of cannabis that has now reduced these numbers to 1 or even 2 a day. It was decided that this strain of cannabis would be called Charlotte's Web. According to the World Health Organization, around 50 million people have varying forms of epilepsy, making it one of the most common neurological diseases globally. Dravet syndrome is a rare form of epilepsy that cannot be cured by regular medication. Sufferers progressively decline in their second year of life and have an increased risk of sudden, unexplained death in epilepsy. So how does Charlotte's Web, a strain of medicinal cannabis, control epilepsy?
This strain is low in THC, the part that makes someone high, and is rich in cannabidiol, or CBD, a non-psychoactive ingredient. Scientists believe the CBD modulates chemical activity, which helps quiet the excessive activity in the brain that causes seizures.
Why Charlotte's Web? Well, it's been effective. CBD has proven to reduce seizures with a much more prominent effect on the body as opposed to regular prescribed medication. The Realm of Caring Foundation has reported that 85% of 27 children being administered with the cannabis oil Charlotte's Web experienced a reduction in seizures of 50% or more. What about prescribed anti-epileptic drugs? Since 1980, the number of AEDs being produced has increased dramatically. Each drug has a different effect and reaction, and not always a positive one. For example, IG epilepsies are prone to pharmacodynamic aggravation increased by CBZ. Juvenile epilepsy is often aggravated by CBZ also. Generalized seizures in IGEs may respond to AEDs that aggravate the other seizure types. Myoclonias are aggravated by the same drugs that aggravated IGEs, and benign Rolandic epilepsy is aggravated by CBZ. You get the idea here. After all of this, why is it important? Because it's on our doorstep. The legalization of medicinal cannabis is imminent. The Victorian government have already pursued an interest in legalizing cannabis, and the New South Wales government have committed to clinical trials to further explore the use of cannabis for children with severe drug-resistant epilepsy. So why not WA? It is estimated that 800,000 people in Australia will be diagnosed with epilepsy at some stage in life, and approximately 25,000 people in Australia are diagnosed each year. So what can we do? Well, we wait. The trials are imminent. All of the evidence, though, suggests this will work in a controlled setting. So throw away your negative perceptions on cannabis and open your eyes to a new way of thinking, a new way to help cure and control epilepsy. And why, you ask? For Charlotte, because everyone has the right to a better life.